Hi, I'm Millie Sullivan. I'm from West Jordan, Utah, and in the United States. I'm a 47-year-old woman. My name is Millie Sullivan from West Jordan, Utah. I needed a knee replacement, total knee replacement. I had a skiing accident about 25 years ago. I was 21. It ripped out every ligament in my knee. It lasted for 25 years. It just totally gave out. I've had the arthritis. I was told the only thing I had surgery in August of last year, and they told me that the only thing that was going to fix me was a total knee replacement. That was really my only option in life. Hopefully, told me hope that I could last about 2 years because I didn't have insurance. I didn't have the money. It's too expensive in the States. And no insurance, so I started looking into insurance companies. No insurance company would take me because they all said it was pre-existing. So I waited until it was getting too painful. So then I started getting online. My husband told me I need to check out some other options. So I went online to see if it was cheaper to go abroad. And I went on and I found some website and it asked me if I wanted to check out the different prices of knee replacements. And it came up, it gave me like Ukraine, the United States price, Thailand, and then Chennai, India. And Chennai, India's was like $7,000 versus the United States was $60,000.
What treatment did you get in the US and did it sort out your problem?
They tried the cortisone shots. The cortisone shots worked well with the arthritis for about a couple of weeks. They didn't help with the other injury that I had, which was just my cartilage was breaking loose and it was sawing through my meniscus and that. He tried then they did the orthoscopic and cleaned up my knee. That obviously didn't help or work. Actually, it got worse. And I don't know if it was going to go worse anyways, but then they gave me another shot and it was a cortisone mixed, and I don't remember what it was, but some gel, and it was brand new, and that absolutely didn't help. That didn't work. They asked me to give it 6 weeks, and I did, and it didn't help at all. So any of the other treatments they did in the United States didn't work. The only option was the knee replacement.
And were you worried that you were a little bit young for a knee replacement?
I was told this, yes.
Yes,
I felt I was too young because I was only 47. They all told me to wait as long as I possibly could on a knee replacement. Any of the doctors I talked to, plus everyone is in their later 60s, 70s before they get a knee replacement.
What made you go in for a knee replacement knowing that a knee replacement is normally done for people above 60 years? Is there anything about the implant and the technique which you preferred?
I was told it's gender oriented. You know, when you can only walk for 10 minutes, you're willing to do anything. I'm an active person. I like the outdoors. I like horseback riding. I like going four-wheeling. I like water skiing. I don't snow ski anymore. I couldn't do any of it. Do you know what? I could barely clean my house. I did the surface cleaning, and then I was done for the day. So I was like, oh, well, I guess I'm young. I'll see how it goes. But he said that the Oxinium knee would last longer, like 25 years. Yeah, I'm almost 50. So what, that'll be 75? I don't know. It might last longer than that. And it's a more flexible. The other thing that drew me to it, two things that draw me to it actually, was this high flex. Like my range of motion would be higher. And it would last longer.
What's your reason for choosing treatment abroad?
Money. My reason for choosing treatment abroad is the price, the cost. He didn't require I have insurance, and because I didn't have insurance, he wasn't going to not treat me. The cost was way less, and I wasn't just a dollar bill to him.
What has been your experience of the surgery, anesthesia, and the whole experience? Say that fully.
My experience with the surgery and the anesthesia and all has been very good. I've been treated very good. The people, it seems like they've all bent over backwards to make sure I'm comfortable and that all my needs are met and everything.
So, how many days is it since your surgery, and what is your functional ability now?
My surgery date was October 23rd, and it's now November 3rd. So it's been 10 days.
And what are you doing right now?
I'm walking. I have to. They told me do I say this? That I'm high accelerated.
Say that, okay.
That my recovery's been really rapid. So I'm above normal on my recovery. I will. So I just don't want people thinking they'll do this and then they don't in 10 days. The way you guys have talked, so everyone has. I'm like, really? I've noticed improvement.
Did you have any anxieties about coming to India?
Oh, yeah.
Yeah, just say that on the spot.
Yes, yes, I've had anxieties coming to India. One, is a long ways away. Two, my family's not here with me, like my husband and my, it's a long ways from home. It's a little scary. But they all make you feel welcome and comfortable, and they make me feel safe and secure.
Did you have any worries about the superbug?
Do you know what? Yes. Right before, about 2 days before I was getting on the plane, they were telling me about the superbug. And worrying and all that. I personally just said, I can't worry about that. I had other things. You know what? This is so important to me.
Do you have the superbug?
No, I don't have the superbug. And you know what? He has checked me for it. And he's made sure that my doctor's made sure of the infections. There is none. He's watched it. He's checked it. He's made sure that he's made sure every possible way of making sure it doesn't happen. I know that's not the words I was looking for, but I am very happy with my knee replacement. If I had to do it again, yes, I would. The experience here has been very good. This is my wonderful Dr. B.
Well done. Congratulations.
Thank you.
I'm very, very pleased about the progress that you've made so far.
Thank you.
Go on and enjoy life.
Thank you.